Hip replacement is a very successful operation. However, hip replacement is a major procedure, and therefore there are risks and benefits that patients have to consider before undergoing hip replacement. The main risks of hip replacement surgery include infection. The risk of infection is approximately 1%, and as surgeons and my team looking after patients undergoing hip replacement, we take various precautions to minimize the risk of infection, such as providing antibiotics before and after the hip replacement, precautions during and after surgery. There's a small risk of clots or thrombosis associated with hip replacement surgery. Clots or thrombosis can go to the lungs and cause a condition known as pulmonary embolism. However, we do take various precautions to minimize the risk of pulmonary embolism and thrombosis. These precautions include the use of stockings, early mobilization, pain relief, spinal anesthetic, all of which will minimize and reduce the risk of these complications, but does not fully eradicate the risk. There's a small risk of the hip dislocating, what is referred to as hip prosthetic dislocation, and there are various precautions to minimize the risk of this happening. There's a small risk, especially in younger patients, that the hip may require revision because of loosening or because the hip is worn with time. These patients may need another surgery known as revision surgery. So in summary, although hip replacement surgery is successful and affords pain relief and better function for the vast majority of patients undergoing hip replacement, there are risks, benefits that one has to be aware of, and also be reassured that precautions are being taken by myself as a surgeon and by my team for all patients undergoing hip replacements. If you're unsure about a particular symptom that you've experienced after surgery, it's important that you call me and my team so that we can assess you and then provide advice according to what your concerns are after surgery.